Hello and welcome to today's webinar. I am Trevor Smith-Miller. I'm the Communications Manager with CCSN. Thank you everyone for attending today's webinar. If you're new to our webinar series, CCSN is an organization working with cancer patients and survivors to learn about the complexity of our health system, connect with others to plan action, and act on those plans to create better outcomes and healthier survivorship. Please visit our website to find plenty of information like news and events, and also information about different cancers and our webinar series. Now, as a reminder, this webinar is being recorded and will be available on YouTube, and a link will be provided by the email you registered with, as well as a copy of the slides. We will add a quick Q&A session at the end of the webinar, but if you would like, please put in your questions in the chat function at the bottom so that we can get them to the end. It should be at the bottom of your screen. Now to introduce today's presenter. Colette Faust is a research director at Leger. It's the largest Canadian-owned market research company, and has 10 years of market research experience, spending the last 3 years in the healthcare industry. As a member of Leger's North American healthcare team, Colette has worked on both quantitative and qualitative healthcare research among healthcare professionals, patients, and the general population across a variety of topics, including oncology. Colette received her BA in Psychology and Media and Communications from Muhlenberg College in Allentown, PA. So without further ado, I'm going to turn it over to Colette to present the results from CCSN's 5th Leger survey on cancer patients with long COVID.
Thank you for the introduction. So to introduce this research, this was a 10-minute online survey among cancer patients who developed long COVID. The goals of this research were to assess the long-term impact of COVID on cancer patients, specifically those who developed long COVID. So how did it impact them and their ability to receive treatment? We addressed some other key topics as well. We asked about the length of time it took them to recover from long COVID, specific symptoms they experienced, what help they're getting from the healthcare system, how concerned they are about long COVID, and the impact on other aspects of their life outside of cancer treatment. We interviewed 119 Canadians with cancer. One specification here: in order to qualify, patients or their caregivers had to have experienced long COVID. So of our 119 Canadians that we talked to, 5 did not experience long COVID themselves, but their caregiver did. So questions were asked about the same topics, the impact on the patient's treatment and access, but they were just worded differently to be about their caregiver. And because it is such a small proportion of our total sample, we've combined them and we're reporting in total here. The survey was made available in both English and French, and data collection took place from March 2nd to May 3rd. And here you can see our regional achievements. Our largest proportions of completes came from Ontario, followed by Quebec, and then BC and Alberta. Of our 119 cancer patients interviewed, 86 came from our LEO panel. So that's our panel of nearly 500,000 members in Canada, which we can utilize to speak to smaller incidence populations such as cancer patients. The other 33 came from open links, which were sent out to CCSN members and partner organization members. And then again, our screening criteria: in order to qualify, you had to be 18 years or older and currently living in Canada, diagnosed with cancer within the past 10 years, and either they or their caretaker had to have had long COVID. And then just a little bit about who we spoke to. Our profile leaned female with 2 and 3 female respondents. We had a good mix of age groups with an average age of 58 years, as well as a good mix of location by population. The most common cancer diagnosis was breast cancer at 26% of our sample, followed by lymphoma. The largest proportion of our respondents said they are currently in remission, and the time since diagnosis varied across our respondents, with 39% saying they were diagnosed 2 to 5 years ago, and an additional 39% diagnosed 6 to 10 years ago. So although this was only a 10-minute survey, there's a lot of data. So we've summarized it for the purposes of this webinar. There's a lot of other data. So if there's anything you have questions about that we don't get to, or you want to see more data on, I have my email on the last slide. Please feel free to email me any additional questions, and we'll also have time for questions at the end. So to start with the overall incidence of cancer patients who developed long COVID. To start, we had just over 1,500 respondents who were diagnosed with cancer within the past 10 years start our survey. Of those, we found 50% had or their caregiver had developed COVID-19. And then of that 50%, 16%, or about 1 in 6, reported developing long COVID. When asked about their initial infection, almost half said it occurred more than 1 year ago, and half rated the severity of their COVID-19 infection as moderate. Patients reported experiencing cough, fatigue, body aches and pains, headache, and fevers most commonly. And then just to point out on the right-hand side there, the callouts indicate a directional or significant difference compared to another subgroup. So for region, for instance, we created the groups Ontario, Quebec, and rest of Canada. So that red Quebec callout of 56% indicates that patients in Quebec reported experiencing a cough as a symptom of COVID at a lower rate than those in Ontario and the rest of Canada. And then some of the other callouts you'll see throughout the rest of the slides are those less than 55 years old compared to 55 and older, males and females, their current stage of cancer, and if their long COVID was formally diagnosed. Nearly 9 in 10 respondents confirmed their initial COVID-19 infection, some with rapid or PCR tests, others at the hospital when they were there for a different reason or condition. Only 8% reported hospitalization for treatment of their COVID-19. Finally, nearly all respondents have been vaccinated to some extent, with only 4% reporting that they are not vaccinated and do not intend to receive any COVID-19 vaccination. However, it is important to note that we asked respondents about their current vaccination status, which may not align with their vaccination status at the time of their infection. For instance, we had mentions of COVID very early on, spring 2020, and as we know, vaccines hadn't even been approved at that point. We then asked respondents about their symptoms of long COVID. 7 in 10 experienced fatigue, and more than half experienced difficulty breathing or memory, concentration, or sleep problems. The largest proportion, nearly 4 in 10, reported experiencing long COVID symptoms for less than 6 months. And when we asked how long it took for respondents to feel that they had fully recovered from long COVID, it was an average of 5 months. However, as you'll see with that green bar there, nearly 9 in 10 report still feeling the impact of COVID-19. So of those who say they are still feeling the impact, we asked what symptoms they're still experiencing. And they're similar to their initial symptoms of long COVID, with fatigue, memory, concentration, or sleep problems, and difficulty breathing being the most commonly experienced symptoms. 3 in 10 were formally diagnosed with long COVID by a healthcare professional, but the largest proportion, 56%, were self-diagnosed based on symptoms. More than half of respondents, 57%, consulted a healthcare practitioner to manage their long COVID. And you'll see in that blue box on the bottom, this mainly includes family doctors, as well as other physicians, and some consulted their oncologist. We also asked about patients getting the help they needed to overcome long COVID or access long COVID treatment programs. 1/4 of respondents said they're getting help. And again, looking at that blue box, you could see this includes medical treatments, counseling, rehabilitation, and long COVID clinics. But nearly half of respondents said they're not getting any help. An additional 2 in 10 said they don't need any help, and 1 in 10 said they don't know where to seek help. So among those who said they're not getting any help, we asked about barriers in getting help. So why aren't they getting help? 2 in 10 said it's difficult to discuss the subject with their doctor. And this was an unaided question, so we were able to look into the open-ended responses. Respondents said their doctor has a lack of knowledge on long COVID or just isn't open to the idea of them having long COVID. Others said it's difficult to obtain a diagnosis, which is a barrier in accessing treatment programs. So thinking back to when we asked about confirming their diagnosis, some said they didn't have a positive rapid test or a PCR test to prove that they ever had COVID. So their doctor was hesitant to diagnose them with long COVID. And related to this, 11% said the barrier was access to a family doctor. Some mentioned that you need to have a diagnosis in order to access treatment programs, and they don't have a family doctor, so they were not able to receive a diagnosis. We asked respondents how concerned they are about their long COVID on a 4-point scale, from very concerned, somewhat concerned, not very concerned, or not at all concerned. And 2 in 3 are very or somewhat concerned about their long COVID. This is mainly due to the potential long-term issues and persistence of symptoms, the uncertainty of effects or lack of knowledge about long COVID, and an overall reduced quality of life. We also asked about the impact of long COVID on patients' ability to receive cancer care. Again, this was a 4-point scale, from significant impact, some impact, not much impact, or no impact. And that top 2 box there is the sum of significant impact or some impact. Being able to see the doctor managing cancer in person for regular follow-up appointments, and being able to get help if they experience side effects related to treatment or new symptoms were the top 2 highest rated attributes impacted by long COVID. But you'll see the next few there, so that 36% to the 34% top 2 box are all similarly rated, and those are about access to hospitals and emergency rooms, as well as getting post-treatment rehabilitative care and other tests. Using the same scale, we also asked about impact on aspect of life outside of cancer care. 8 in 10 said there was a significant or some impact on their overall state of health and well-being. Ability to exercise, participate in social engagements, hobbies, sports, and other activities were also all impacted. 4 in 10, and among females and those younger than 55, this is more than half. Among that 43% who said there was a significant or some impact on their financial well-being, half said that this was due to their inability to work as usual or full-time. So this was another unaided question, and respondents had the space to clarify that they can't work full-time anymore because they cannot make it through the day without having to go and lie down, rest, or take a nap. About 1/4 said they experienced an increase in expenses. This could be because they're paying more to have food or supplies delivered so that they don't have to leave the house. And some others mentioned that they've had to hire help. 1/4 also mentioned an inability to work altogether, leading to a loss of income. So after asking a lot about the patient's experience with long COVID, we then asked what support or services they need to overcome their long COVID. Better access to and support from a doctor or family doctor, a treatment, medication, or cure, and more information or counseling were most commonly mentioned. And again, this reflects back to getting help and the respondents who said they had difficulty accessing treatment programs or talking to their doctor about the possibility of them having long COVID. They need to be more supported by their doctors and have more information or advice on what they should be doing. Finally, we asked what their new quote unquote normal is, living with cancer and experiencing or having experienced long COVID. Respondents report getting accustomed to living with a new level of fatigue and lack of energy, along with increased anxiety and depression, an overall reduced quality of life and well-being, and being more careful and following health measures. Again, in open ends, respondents who feel that they have fully recovered mentioned never wanting to feel like that again. So they never want to catch COVID again, just in case it would turn into long COVID again. So they feel the rest of the world has moved on, so it's difficult for them to feel that they can go out in public and live their life to the fullest extent. They feel like they've been left on their own. So then to summarize all of that into one slide, overall, of cancer patients who were infected with COVID-19, 1 in 6 may experience long COVID. While 3 in 10 cancer patients showing symptoms of long COVID were formally diagnosed by a healthcare professional, about 1 in 5 consulted a healthcare practitioner but did not receive a formal diagnosis. 37% in total reported having difficulties being diagnosed. In some cases, this was later problematic, as in order to access long COVID treatment clinics, patients needed a referral. And this was additionally problematic for those without a GP. Nearly 3 in 5 respondents have looked to a healthcare practitioner for assistance with managing long COVID and treatment options, while 1/3 have not discussed their long COVID with any healthcare practitioner. About 1/4 are getting help to manage or treat their long COVID, but half say they're not getting any help. Of those not getting any help, they feel their doctor has a lack of knowledge of long COVID or a lack of receptivity to their having long COVID. Patients feel that better access to and support from a family doctor, a treatment or medication for long COVID, and more information and counseling about long COVID would help them to better manage their long COVID. The 2 biggest areas of impact that having long COVID had on receiving cancer treatment were related to being able to see the doctor who is managing cancer in person for regular follow-up appointments and being able to get help if the patient experiences side effects related to treatment or new symptoms. Access to hospitals and emergency room care, as well as getting tests and post-rehabilitative care, were also impacted by patients' long COVID. In other areas of their life, cancer patients who experienced or are experiencing long COVID felt that long COVID had an impact on their overall health and well-being, as well as their ability to exercise, participate in social activities, or other hobbies and activities. 43% said long COVID had a significant or some impact on their financial well-being, with more than half of females and those less than 55 years old reporting some or significant impact on their financial well-being. And finally, while some patients have fully recovered, others think that the new normal is adjusting to life with an ongoing sense of fatigue or lack of energy, along with increased anxiety, depression, and a reduced quality of life. Thank you.
All right. Well, that was the presentation, and we also have a copy of the slides with us. So if later on, whenever we post this, if anyone wants to look over the findings in detail, they are more than welcome to. Now we have a quick Q&A session, but also don't hesitate. Put your questions in the chat, and we'll get to them as we get to them. One of the first things, Colette, there's a whole bunch of, I think the main gist of that survey is that there seems to be a lot of different, there seems to be not a lot of consistency and a lot of gaps in the medical field about long COVID. And I was wondering if there's anything that stood out to you from the comments that kind of showed just how much of a problem it is that long COVID isn't quite being, it doesn't really have that kind of working definition, or in some cases just not being taken seriously by healthcare practitioners.
Definitely. There are a lot of different definitions, which has even made it difficult to, find the incidence of those who have long COVID, because it differs by definition. And then the symptoms are also difficult to define because they overlap so much with other conditions, and these are cancer patients. So a lot of these symptoms also overlap with the side effects that cancer patients see from their treatments. So that was definitely, and we even saw with the incidence of those who had their long COVID formally diagnosed. So a lot of this was based off of symptoms, but we really can't be sure of the formal diagnosis.
Mm-hmm. And one other question actually that I have is that we talked a little bit about this whenever you were showing the preliminary results to staff here at CCSN. I brought up the question if there is any sort of connection between long COVID and cancers, or if they say that it's more likely for cancer patients to get long COVID and stuff like that. And I think that your answer was there's just the data that you kind of presented just not quite enough to really make any conclusive judgment call on that.
That's correct. So outside of cancer patients, we have not done a lot of formal studies that have been published among the Gen Pop and long COVID, but there has been some preliminary data. And again, this differs by the specific definition of long COVID that you're using, but that 16% that we saw does align with some other preliminary research. So we can't say conclusively, but we're not seeing a higher rate of long COVID among cancer patients compared to the general population.
Mm-hmm. Now, as you said that I believe that you said in the presentation, or we said this in a conversation, that typically a lot of surveys like this, they're filled out a lot more by women in that sense. And if you can you go into a couple of details actually about why that is? Because one thing that a lot of people have pointed out in the cancer community is that when it comes to survivor groups and kind of in advocacy in itself, a lot of cancer survivors that do speak out are women, but not so much men. So if you can comment a little bit about that, about the tilt, the skew that the survey has towards women.
Of course. Yeah, I'm not sure if I can say so much of the actual why, but that is something we see across all research, that females are more likely to participate and older respondents are more likely to participate. So in almost all research you do, you're looking for more young males because they are least likely to participate in any research.
Mm-hmm. And also we're talking about another skew goes from province to province. In your, if someone asked you to explain why there's such a discrepancy aside from population in the geography of the survey, what would you say? Why would it, for instance, why was it that more people were talking from Ontario and Quebec than say the Maritimes or from BC?
Well, we did not weight this data, and that is something that we do with any Gen Pop survey. You weight it to match the demographics of the population, and that is the demographics of the population. The most Canadians live in Ontario, so typically any research we do, you're going to have the most respondents in Ontario.
Mm-hmm. And once again, if you guys have any questions whatsoever, put it in the chat. And one final question from me. You have mentioned that in Leger that there's a lot of research that is currently being done on long COVID. Are you able to discuss any of that research at all? And if you are, how does it kind of compare to what we've learned here in for CCSN specific survey?
Sadly, I cannot, but we're always looking to publish some of our surveys where we can, and especially in partnership with clients. So if there are any publications, I will let you know.
Excellent. Thank you so much. Now, again, if anyone has any questions or comments, don't feel free to send them in the chat. But for now, a little bit of housekeeping. I'd like to thank everyone for participating, and a special big thank you to Colette and the team at Leger for doing the survey, for shining a light on long COVID and creating this data point for long COVID in the future. Now, this is one of a series, our webinar series that we are doing. Currently, we're going to be taking a little bit of a break over the summer, but we have a lot of stuff ready and lined up in the fall. So if you are subscribed to our newsletter, you can check on our website as well for upcoming webinars. If you're not seeing it in your inbox, just be careful. We have a third-party email service. If you don't see it, just look down in your folder and in your spam folder, it might be there, or you could have been unsubscribed without your knowing. So just go back onto our website. We have a slide on our website where you can subscribe once again to the webinar series. And if you're on our website, you can find all of our webinars on demand, as well as information about cancer, our blog posts, and information about what we do, as well as our Science of Cancer course. Now, I don't see any more questions in the chat. So once again, Colette, thank you very much for the presentation. And I hope to see all of you on the next one. So bye for now.
Thank you so much, Trevor.